Video on seizures, epilepsy, and either taking medication or not taking medication. I personally was nervous to take medication because I was 12 at the time when I first started having seizures, and I was afraid that if I got on medication, it would mean that I would be on medication for the rest of my life. Now, that is totally a possibility. It is often that people with epilepsy have to take medication for their whole lives to stop the seizures. So I was thinking, and my doctor was thinking, and my parents were thinking there was the possibility that I would outgrow the seizures. Because some people have epilepsy during the time that they're a teen, and then, say, the end of their teens, sometimes it goes away. Now, as with most epilepsy, we do not understand it very well, and so that means that there is that possibility. I figured if I was on meds, it wouldn't be obvious whether I was still having them or not, and so I wasn't sure how I would go off it, or when, or if. So I just wanted to give my opinion on taking epilepsy meds, and I definitely believe that we need to treat seizures. The difficulties of taking epilepsy meds and the possible side effects, the possible long-term effects, and the just not liking them, not believing in taking meds, believing that pharmaceuticals are bad for you. All of those things in my life were not important enough in that I would still take medication going back. So I didn't take it till I was 19, which means I had 7 years of having tonic-clonic seizures, and now I know I was also having simple partial seizures. I didn't start taking medication until I was 19 because, like I said, we were hoping that it would go away. Well, during that time, from 12 to 19, I had over 100 tonic-clonic seizures. That's a lot. Each of them was upsetting, difficult, and just, traumatic. Like, I would wake up from a seizure and I would be confused. Most of the time my seizures happened in my sleep, so I was in bed, which I was really lucky because maybe 90% of my seizures were in my sleep. So I had very few where I actually fell down from a standing position. So I was safer than a lot of people who have tonic-clonic seizures. Still, I would recommend that you treat your seizures, because the more seizures you have, the more you create the neural pathways that increase your seizures. So it's like thinking about, when you learn something new, the more you do it, the easier it is. Well, that kind of happens with seizures because your neural pathways are created and then they strengthen. So the more you have seizures, the more easily you will have seizures again, most likely. So stopping the seizures and taking medication from a very beginning, a very early phase of learning you have epilepsy, in my opinion, is a really good idea. So if that means you take cannabis oil, if that means you take regular epilepsy medication, Western medicine, I think it's really worth it. And I would not keep having tonic-clonic seizures if I realized that it would be so traumatic for me. So I just am wanting to make this video because I really feel like it's important if you're questioning whether it's worth it to take epilepsy meds. I personally think that my life is so much better. It is so much more functional. I am clear-headed. I don't like the meds, granted. I have side effects. I feel, all these different things from them. They tend to increase my depression. They tend to, but I have to take other meds to make up for that. I don't like it, but I really feel that it's important. And so I just want to encourage people who are questioning, especially if you're into alternative medicine and you really don't want to take meds. And either if you're questioning it for your children, especially parents who are wondering, is this really a good idea with my child? Because, is it worth stopping them and taking a medication that I'm worried will harm them? Or is it better to just have them and not take the medication? From personal experience, I would say take medication, because actually having tonic-clonic seizures until I was 19, then starting medication, which didn't stop my tonic-clonic seizures until I was 22, then taking a medication that did stop my tonic-clonic seizures, but I did not realize was not stopping partial seizures until I was 27, and then finally taking an extra medication to stop the partial seizures, and that means that now I am on 2 medications. Almost all of my seizures are stopped. The tonic-clonic seizures, the grand mal seizures, and the partial seizures, in my case, simple partial seizures, are almost all stopped. I still have a few. I deal with them, but my life is so much more functional, happy. I'm not confused all the time. I'm not, I don't have headaches all the time. I don't have weird experiences of feeling, these partial seizures and having headaches before and after the tonic-clonic seizures, having, triggers that cause me to be more likely to have tonic-clonic seizures. Everything about it is very difficult, and for me was extremely traumatic. I still have difficulties with things that bring up all of the times that I had seizures and woke up and was so traumatized. I don't know that people really understand how difficult it is to have a seizure and to pass out who knows when, at any time, then to oftentimes hurt yourself and wake up having had this situation where you, oftentimes people have tonic-clonic seizures, which is where you stiffen up and then you shake. Now, that is so hard on your body. And I pulled my shoulder 3 times, 3 months in a row, and I tore my capsule on my shoulder. And nobody realized what had happened. I was in a lot of pain, but nobody thought, oh, maybe she actually tore something. Maybe it's not just a muscle that was hurt or pulled or something. I actually went 7 years having a lot of pain and a lot of problems with my shoulder before I was diagnosed with this torn capsule, had a shoulder surgery, and things got much better. So there are dangers of having seizures that people don't even think about all the time. And if you have uncontrolled tonic-clonic seizures, I hit my head before, I fell down a set of stairs. I could have really been injured. I could have had traumatic brain injury. There's a lot of problems. The other thing is that I almost went into status epilepticus one time, and you can die from that. So having seizures is probably not worth it. Taking medication is probably worth it. That's my experience. I hope you take whatever you can from this. I hope you treat seizures as if they are a big deal and they need to be treated and stopped. Because I think the only way to have a life that is good is probably to stop your seizures as much as you can. Obviously, some people can't. They try every medication, they try surgery, it doesn't stop it. Some people are afraid to have surgery, but when they do, it does stop it. There's all different kinds of means of dealing with them. However, about 70% of people can manage their epilepsy with medication. So I highly recommend that you try medication and try to stop your seizures. It's really important to stop seizures.